Hey, hello everyone. My name is Ruben Kiss, and it looks like the topic for this week is going to be healthcare informatics. So, before I really get into answering actually the first question is what experience have I had with healthcare informatics as a professional slash clinician? And before I really get into answering that, I want to go over what our article this week kind of defined informatics as. I guess it defined it. So, the article states the term informatics attracts a number of differing interpretations. Some are scientific. Informatics studies the representation, processing, and communication of information in a natural and engineered system. It also says in healthcare, its derivative health informatics is seen as the knowledge, skills, and tools which enable information to be collected, managed, used, and shared to support the delivery of healthcare and to promote health. So, to me, that definition more or less kind of shows like in modern times, that's usually whatever platform we're using to kind of track patient information, whether that platform is, it's no longer, it seems to be based off of paper charting, but more off of like, are we using Epic? Are we using Cerner? Those are the two platforms that are used here in Springfield at the local hospitals. Or are we using a whole different platform altogether? With all these platforms, we can start looking at its limitations and what its pros and what it's good for and what some of the problems we see with it. But let's see, it goes back to what experience have I had with it. I guess starting out when I was a medic in the army, the first time I used any kind of charting on some kind of informatics based system, some kind of electronic charting, I used I was it was more like they called it a healthcare specialist was my profession, and really what I did when I was working in the clinic was I'd get patients' vitals and screen them and start the process of getting their soap note ready. And what I would do is I'd put that or get their information from them, get some vitals, and enter it into the system and pass it on to the physician. Now I'm working as a respiratory therapist. When I was a student, I worked or we did rotations at Cox and at Mercy, as well as at CMH and Bolivar. The platforms that we use there were Epic and Cerner, and now it's kind of the same thing, except for I'm collecting different information and inputting it into the system. And also, some of the differences that I kind of see is, I guess, as I've grown in my healthcare field or profession, I get to now look at certain things. So I'm looking at chest X-rays. I'm looking at different aspects of what is expected of me at my job, and I can see physician notes, I can see notes that other therapists have put in, I can see what we're doing kind of with patients. So the next question, what experience have I had with healthcare informatics as a patient? So as a patient, just being seen at different facilities, especially a facility more than once, having my information, get input, kind of like what I was talking about before, or having my information accessed from a previous visit. So instead of them asking me and relying on my drawback of information, it was like, well, have I had any of, or what is my past history, especially with dental? It's like, oh, have I had this done? I may not remember when my last cleaning was. But if they have it in their information, they can see and they don't have to rely on necessarily the patient's memory. So that's kind of the experience I've had with healthcare informatics as a patient. Next question is, have you ever participated in telehealth? If yes, what were the benefits or downfalls? So, telehealth specifically, I have not participated in. I have not been a part of it whatsoever, but I have participated in teleplatform. It was with my banking system. So, I bank with USAA, and they don't have a lot of facilities all over the United States. And one of the times when I had to speak with somebody, they had a center where I can go in, and it was like a teleconference, and they pretty much like a Skype thing where I could see them, they could see me, and they were able to assist me. And I think one of the great things about that for me at the time was more of I can, I can communicate with the person and I can put a face with it. But at the same time, if there were like things I needed a signature on or other things like that, it's a little bit better. It has its limitations, I guess, if you will, on what you can do with it. But it's still, in my opinion, especially for a healthcare thing, you can see the patient. If somebody tells you they're not feeling well, you can see usually if somebody's in distress. If somebody says it's hard for me to breathe, but they're sitting over there, just they don't look like they're really in distress. I mean, you can't just rely on the telehealth conference, but you can, it puts things in perspective. It's like, well, how much distress are they having? So that's one of the benefiting things about that. Um, how has telehealth informatics benefited you? Um, for me personally, it kind of speeds up my job process. I don't have to do as much paper charting. I don't, I can, I don't have to rely on getting information or storing information in a certain way. The platform is already there for me to do it. It makes it fast. It makes it easy, and it just speeds up that whole process. What downfalls have I seen with healthcare informatics? So, excuse me. Um, I think the biggest downfall that I've kind of noticed just from this class and from other classes and from experience is, if somebody gets a hold of, you know, an ability to get into the platform that is not an authorized user, um, it just the extent of damage that that person can do in that platform, it can be astronomical. They can really get in and sell patient information. They can falsify charting. They can falsify data. They can steal a whole bunch of records, and who knows what their plans are to do with them at that point. So that's one of the downfalls that I kind of see. The biggest downfall. Another downfall is we have all this technology and information, but a lot of times the information is not shared because we don't all use the same platform. A lot of times it takes a little bit longer to get information from different platforms. Whereas if we had one big database that could transfer to all the platforms, I think that'd speed up that process and make it a lot better. Um, Last question: what type of healthcare informatics have you seen to be most impactful for a patient to comply with treatment? Um, I guess just you know, especially with me working as a respiratory therapist, having patients coming in over and over again for the same issue. If they have COPD and COPD exacerbation, they're a smoker. It's like, this is your fifth time coming in with the same issue. And while you're here with us, the issue doesn't really, it seems to resolve itself. As soon as you go home, what is the difference that you're experiencing? Are you compliant with your medications and are you still smoking? And usually they say that, either they are or not compliant with their medications, but a lot of the smokers, they just go back to continuing to smoke. So a lot of them eventually, seeing this constant documentation and having the realization of like, this is the thing that's hurting me. Um, that kind of gets them to comply with their treatment, either to start taking their medication or to stop smoking or both. So that's a good example of that. And the last one, I guess I answered all the questions. I just want to talk about a new product by Ventec. It's a ventilator that it's called a Voxen ventilator. It does five things in one. It does ventilation. It can nebulize medication. It's a portable oxygen concentrator. It has a suction unit in it and a cough assist. So one of the cool things about this is I just recently went to a respiratory therapy conference in Louisiana, New Orleans, and one of the vendors over there was telling me about, it can not only do all this, but it can track the patient's information. So with it tracking this much patient information, I was thinking about, you can see it's almost like patient tracking and, healthcare informatics in a way to store their information away from the hospital. And I was like, how great would this be in a home health setting? So, for a home health setting, if we can see, how many times was this patient suctioned, before they came to see us in the emergency room, was there a trend or were they getting their breathing treatments? Maybe they skipped a breathing treatment for 3 days in a row. And usually that happens. That's the instance that happens before we see them in the hospital. So if we can track these things, we can kind of better manage our patient, not only while they're in hospital, but out of the hospital. So I was just like, this is a super cool product that, is it's kind of, I think, a big stepping stone to, having patients being properly cared for outside of the hospital, and us to be able to, hold the patient accountable, hold the caregiver accountable, and just kind of get a big picture of what happens with this patient when they leave the hospital. So that's all I got for this week. I guess I'll see you guys on the next video.